Welcome, everyone. This is the Board of Health meeting of May 4th, 2020. I'm Judy Giorgio, the health agent for the town. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting General Law, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 1-347-379-1643, and the conference ID is 335-603-01#. Despite our best efforts, if we are not able to provide for real-time access, we will post a record of this meeting in the town's website as soon as possible. So now I'd like to turn the meeting over to our Board of Health Chairman, John Beckley.
Thank you, Judy. As Judy said, this is the May 14th, 2020 Board of Health meeting for the town of Chatham. Today's agenda, we have 3 items, plus we have to review and approve 3 prior board meeting minutes before we adjourn. So why don't we start with item 1 on the agenda, which is an update and a discussion on the coronavirus with Dr. Robert Duncanson, the Director of Health and Natural Resources. Dr. Bob?
Yeah, good afternoon. Dr. Robert Duncanson, Director of Health and Natural Resources. Hopefully everybody is doing well. I just got the latest figures in from the state of Massachusetts, so give me a second here and I'll go through them. Just to give the board and the folks at home an idea of where we stand, worldwide right now, we are at roughly 3,560,000 cases, and unfortunately closing on 250,000 deaths worldwide. We're at 249,712, and that was earlier this afternoon. I suspect by now we are probably over 250,000 deaths worldwide. In the U.S., we had roughly 1,172,000 cases and a little over 67,000 deaths. Now, the latest numbers coming out of Massachusetts, we have 69,087 cases. That is an increase of 1,000 cases of COVID-19 since yesterday's report. And these reports are coming out every day at approximately 4 o'clock. So in the past 24 hours, we had another 1,000 cases. Unfortunately, the deaths have also increased. We are now at 4,090 deaths in Massachusetts. That went up 86 from yesterday. In Barnstable County, we are now at 961 cases, an increase of 15 from yesterday. And I'm happy to say there were no new deaths in Barnstable County reported in the last 24 hours. So that is encouraging news.
So Bob, what's our current number in Barnstable of deaths?
We are now at 47, the same place we were yesterday. Yep. In Chatham, we have 11 laboratory confirmed cases, and we've had that for the last couple of days. And I just wanted to note that approximately 50% of those cases, I hate to use the word have been cured, but they are no longer considered active cases, if you will. I've used the word resolved before, and that led to some confusion, but approximately 50% of our cases in Chatham, we would no longer consider, and in the state system, they are no longer considered active cases, but we do have 11 laboratory confirmed cases since the start of this. We have one other case that we're currently working through resolving that involved a medical transport last night by the fire department, and we're just trying to get confirmation if that was a new case or that was transport of a case that we had already accounted for. So that's in the works. So we're holding at 11, and we're trying to update that whenever we get new information in. As I'm sure everybody's aware, the governor extended his stay-at-home advisory until May 18th. So we have another 2 weeks of the stay-at-home advisory. And any other major news was on Friday, he issued an order requiring face coverings whenever folks are out in public and unable to maintain the recommended social distancing of 6 feet. And that order pertains to everyone over the age of 2, should have a face covering on, and at any time when you're in a grocery store, a pharmacy, or other retail stores, once they open. At this point, we don't know how long that's going to be in place. Obviously, it will stay in place at least through the 18th, and I suspect, given the information that we're seeing out of CDC and WHO and others, the wearing of face masks is going to be with us for quite a period of time here. Some folks have indicated, maybe even through the summer and whatnot, but that remains to be seen at this point. Testing in Massachusetts is also going up substantially. We're still not at the place where we can get everybody tested. Anybody that wants it can just walk in and get tested. Although that is hopefully in the not too distant future, because the testing facilities and the tests themselves are becoming more widespread than they were, this time a month ago, when they were really limited to those folks that were showing symptoms or first responders and others. So with that, I think that's all I've got for today's quick update, and I'll be happy to answer any questions.
Bob, John Beckley, the testing that you just referenced, is that an actual diagnostic test, or is that a serology?
Well, right now there's 2 tests out there. The one that I was referring to primarily was the serology. We are seeing there's a number of commercial labs now that are doing that. So those tests are becoming much more widespread. So we're kind of getting away from the strictly diagnostic testing where we were for quite a while, which just indicated active infections. We're now to the point where we can start, mass screenings, although we're still not there in terms of the availability of those tests, but the technology now is kind of catching up to the point where we could do those mass screenings, because as we've talked about before, upwards of 80% of the population may be asymptomatic. And that's one reason why COVID-19 has spread so quickly and so worldwide, because so many people have it and they just don't know they have it. But hopefully with the serology test becoming more and more widespread, we'll be able to get a better handle on that. One of the first studies looked at a large population in Orange County, California, and they estimated, based on the results that they got, that the rate of infection within the community was 55 times higher than it was originally estimated, because so many people are asymptomatic or have very mild symptoms that, this time of the year can be confused with the flu or allergies. And so people just don't know they have it.
Wow.
Bob, this is Noble. Can you just go over who can get a test now?
Right now, the majority of the testing on the Cape and in Massachusetts is still being directed towards either folks that are symptomatic, or there's a large push on to get all of our elderly population that are in nursing homes or assisted living facilities tested, because I'm sure everybody's aware that has been a population that has been very hard hit So there's a number of initiatives underway now to get them all tested, as well as all the various caregivers, for those folks tested. There's also an effort underway to go after the homeless population and get them tested. And if they, test positive, get them into locations where they can be isolated, just because they don't always have, the luxury of being able to self-isolate and whatnot. But as I said, we're not quite to the point yet where, everybody can just walk in and get a test. Hopefully that's going to come here shortly, but we're not there yet.
Yeah, but right now, if an individual wants a test, they call their physician. They go work through their physician who orders it.
Yes, and especially in this area, yes, you still need a physician's order to get those tests because they are still in somewhat limited supply. Yes.
Right. Good.
Bob, this is Judy. When you say serology testing, do you mean testing for immunities?
Yeah, the antibody test. Yes.
Antibodies, correct.
Yes,
Okay.
the antibody test or the serology test, as we call it. Yeah. Yep.
Right. Okay. I just wanted to clarify that. Thank you.
Yeah, and just so people are aware, and this is one of the, kind of the big unanswered questions that we still don't know. Even if a person tests positive for COVID-19 or antibodies to the coronavirus, we still don't know whether that's lifelong immunity, or it's going to be the kind of thing with the flu where every year you need to get a shot. So just because somebody has antibodies doesn't mean you, may not get it again, or if you haven't had it, well, obviously you've had it. Yeah.
This is Elaine Gibbs. If I could jump in, I just wanted to mention that I did get the antibody test done because I wanted to know if I had been exposed. And it's really simple. You just go down to the urgent care that's at Patriot Square and they draw blood. And I got the results in 24 hours. I was negative, so I had never been exposed to it. But I wanted to know because I happened to have had pneumonia when this was going on, but it was not related to anything. And I didn't know if while I was in the hospital, I had actually caught it because they were bringing in patients. So I think it's worthwhile for people. Right now, you have to pay for it. I think it's $50 to the urgent care, and then Quest will charge another $50. But if you are quarantining now, to a certain extent, wearing masks and stuff, it's kind of good to know one way or the other if you're negative, that you haven't been exposed over the last 2 months.
That's interesting, Elaine. This is Judy. I did not know that you could walk in and get that type of a test done here on the Cape, so that's good information.
Barbara Siegel, I have a question for Dr. Bob. We get the flu shot every year because the strain changes and it's a different type, maybe a modified virus. We don't know with the COVID-19 if the vaccine is available, we get the vaccine. Will we need it every year, or because it's going to change, or how is that all going to work? Although I'm sure we don't know right now.
Yeah, you're absolutely right. Unfortunately, we don't know. I did see some information out of India a couple of weeks ago where they reported that there was a different strain of the coronavirus going around. That doesn't bode as well, or doesn't bode well at all for a vaccine, because then you're kind of getting into the flu situation where every year it's a different strain. That's why you have to get a flu shot every year, as opposed to some of your other illnesses where you get one shot as a child and you've got lifelong immunity. So at this point, we just don't know that. There's a number of clinical trials underway with vaccines. Right now, there's over 100 vaccines worldwide that are being tested. There's 3 or 4 already in the U.S. that are under clinical trials. And hopefully, as those, start to ramp up and get further along, we'll start getting answers to some of these questions. But right now, this illness is basically so new, there's a lot we just don't know about it.
All right. Thank you, Dr. Bob. Anybody have any other questions for Dr. Duncanson? Nope. All right. Let's move on to item number 2 on the agenda, which is a discussion of short-term rental standard recommendations. Judy, do you know whether Mr. Chapman is on the call?
Yes, Luke Chapman is on the call, so if Luke, if you'd like to just discuss what you had sent to the board for discussion.
Sure, I'd be happy to. Thank you all for having me on. Does everybody have the one pager that I had sent over?
Yes, it was in your packet, and it's also, it was posted on the website with the agenda.
Okay, the title is Short-Term Rentals, COVID-19 Standards. And just by way of introduction, I am on the Board of Health in Orleans. I also am the owner of Del Mar Vacations here on Cape Cod, which is a locally owned business in 9 towns on Cape Cod. We are not a franchise. And we clearly are dealing with this crisis, as many businesses are, and trying to balance the safety needs as well as the reality of our local economy and the tourism. So with that, I also should share that I'm in close connection with about half of the state's 17 members of the reopening committee, with our regional legislative board, with the Department of Public Health for the state. I've been having interviews and conversations with all members, all of these different associations over the last week, probably upwards of 20 at this point. And they've indicated that they're looking for recommendations from all businesses for how they can open safely. And in our case, they're looking for potentially some recommendations on how oversight could be provided for short-term rentals. And the state is not going to be in the position to provide that oversight. So those are sort of two things that have been put on my plate. And I will be putting together a template example to provide to the reopening committee. I'm happy to forward it to this board or health department for what homeowners and rental companies can do to self-monitor and report to the towns. So with that said, that sort of long introduction, if you're looking at the proposal, I sort of break it into a few sections, but the summary is effectively hotels, inns, and homes should be treated with equality under any state or local guidelines. That vacation rental homes, professionally managed, often provide added health and safety advantages. That cleaning and disinfectant standards should be posted and adhered to by all short-term rental businesses. And that the economic impact of deterring tourism for even just one season would be truly unbearable for our region, for our towns. So I won't read every single bullet point on that page, but I think what you should see as the cleaning standards are, some of them speak to some additional items that are not standard on Cape Cod, or that might be sort of, just sort of region specific. As an example, a lot of people will clean a refrigerator and leave all of the leftover condiments. This is something we as a company have never done, but it's pretty common in our region, and that, of course, that type of thing should be discouraged. So I won't go through each of the cleaning recommendations, but they are all additive to sort of standard house cleaning. So things that are more specific to the COVID-19 crisis. And so that's all I wanted to introduce today. I suppose it's a line of communication I'm looking to open up, and certainly happy to be a resource to this board and the town of Chatham as needed as well.
Could I ask two quick questions? Ron Broman.
Opening.
Is Mr. Chapman there? Okay. What is the term of a renter, short-term rental? What is the period of time? I mean, is a year a short-term or?
A short-term rental, that's a great question. It goes up until 31 days in the state of Massachusetts. So 32 days is not short-term. And
Okay.
it also, that term applies to all establishments, all lodging establishments. So whether that's vacation homes, hotels, inns, or bed and breakfasts, those are under the new Massachusetts short-term rental law.
Okay, my other question was, how would this ever be enforced?
That's a great question. So it depends on the town. Assuming towns would be the monitoring and enforcing mechanism. And I just got off of the Orleans Board of Health meeting. It seems that one suggestion would be to establish the standard and promote it as a starting point. So sometimes people just need information and they need some direction. And so that's a good starting point, and that's certainly where the Orleans Board of Health is leaning. As far as enforcement, like I can give you examples. The town of Eastham has they have for a long time, a pretty involved vacation rental monitoring system. I'm not an advocate of it. I think it's pretty invasive for private homeowners, but I would suggest that in this crisis, it might make sense to have a self-reporting system that is turned into the town, perhaps even on a monthly basis in terms of inspections and confirming people are following guidelines.
Okay, thank you.
Ron, this is Judy.
Hi, Judy.
Yeah, Luke is correct. In Chatham, we don't, obviously, we don't have a rental bylaw or any system for monitoring the short-term rentals. We do inspect annually cottages, hotels, motels, and rooming type units. But it would be difficult for us to really monitor these short-term, especially the Airbnb, single-family home type. There's thousands of them, I think, in Chatham. And it would be difficult to monitor them, but I think putting out some type of a standardized list, and I think this is a good starting point that Luke has put together, would be a good thing. But I would like to see what the recommendations from the state. I don't think they're going to be this specific, but as we move forward, we'd like to get guidelines from the state and DPH as well. So
yeah, well, I knew, I know it can't come back on you because we looked at something else like that some time ago, and I remember it was going to involve you with a board going out and inspect things and everything. We just said, this is impossible because your time is very important, and where do we want to spend it? So
right.
Okay, all right, thank you.
This is John Beckley. Luke, so we can assume that the work you put into developing these recommended standards is being or has been shared with the Reopening Advisory Board at the state of Massachusetts, true?
That is true.
So when I listened to the governor's updates today, and it was made very clear by the lieutenant governor that the recommendations, or the report, we could say, coming from the Reopening Advisory Board are expected to be released on the 18th of May, I believe. And that got a lot of people thinking that that was going to be the actual date of reopening. But she clarified that that was not necessarily true. However, there would be a product coming from the Reopening Advisory Board that would spell out exactly how they would do the phased reopening in the Commonwealth. So I'm expecting, as a local Board of Health member, that when they release that report, there should be plenty of detail provided on how the short-term rentals would have to be set forth. Do you agree with that, Luke?
I don't know that I agree with that. I have, in my conversation with the DPH, they indicated that the CDC guidelines for facility cleaning are probably going to be like the extent of the details, so to speak. And that probably, the state of Massachusetts would not be, generating like cleaning specific rules and regulations for various business types. So my sense is that you're spot on in terms of May 18th being the date they sort of disclose the slow opening and which businesses sort of can start to operate, on which dates. But I don't know that they're going to be giving very detailed cleaning guidelines. And, listen, at the end of the day, I put this together to try to be helpful. And if it can be a guideline that's regionally helpful, that's great. If it's not, I certainly don't want to waste anybody's time either.
Well, I hope we don't get into a situation where every town in the Commonwealth is trying to develop their own local protocols or standards.
Yeah, I suppose I've been asked to suggest a meeting on Wednesday with the head of the Cape Cod Chamber, who is sort of working through lodging issues that they're going to present to the state board. And I've asked my team to put together sort of an oversight checklist as well as a reporting sort of like pager. So we're creating 2 one-pagers that are getting pushed to this committee and may get pushed to the state. And maybe they do push that out as sort of standard guidelines. That's how I'm trying to be helpful. I could see the challenge of each town trying to like finagle its own, protocols for each different business type, and that could just get, completely overwhelming.
Yes.
And John, just so you know, all the board, all the health agents or all the towns, we do talk weekly, and we've discussed some of this, and trying not to all be doing something individually and coming up with some set of guidelines for each area, and working with our town administrators as well. So hopefully we won't all do something different, and we'll have one voice to speak with.
I think you need to petition the State Department of Health to bring something forward.
And we have. I mean, we talk to them as well, and people have been asking for that kind of guidance every week, and they just keep saying, it's coming, it's coming, it's coming. So hopefully it's coming.
This is Noble. I have a process question. I'm assuming that we would be waiting for the state guidance about when they're going to open and what they're going to say about short-term rentals. And then after that, the towns would be working on the specifics of the exact rules that they would put in place. Is that true?
Yeah, I think that's about accurate.
We wouldn't start on real specific, or would we start on real specific rules before we heard what the state was saying? I'm assuming.
Yeah,
I would ask you.
I think I agree. I would want to see what comes down from the state and then see how we have to refine that.
So this is all information for us to have stored for when we have to really get to work on it, and that would be after the state issues some new order about opening the short-term rentals.
Yeah, Noble.
Yeah.
Yeah, it's Bob. As Judy alluded to, I mean, this is way more than just a Chatham issue. I know that there's an effort underway for the entirety of Barnstable County. There's efforts underway at the state. How effective the state's going to be, who knows? But I know there's efforts underway at the Barnstable County level, because the last thing any of us really want to see is every town having something different. Especially on Cape Cod. So there's a lot of work going on right now to try to come up with something that could be implemented kind of uniformly across the Cape. And we'll just, I think everybody is kind of waiting. Well, I shouldn't say waiting. That's not the right term. everybody's kind of in anticipation of what the state may come out with and when the state may come out with it. Obviously, this is all somewhat moot if we're still under a stay-at-home advisory, for another month or whatever. So, everybody's trying to work to get things kind of set so that when the floodgates do finally open, we're not all caught flat-footed, but things can be implemented fairly quickly and there's uniformity, because that's really what everybody's trying to achieve.
Right. That's good. That basically answers my question.
Yeah. Luke, could I ask you another question? Ron Broman. The state must have this thing that you recommended, your short term. And has other towns looked at this and also supported it so that at least the state would see what people are looking at? I mean, they're probably not going to have everything you have and that, but at least some close to it.
Yeah. I haven't sent it to every town yet. Actually, I may have sent it to every town dentist to Provincetown. I think I sent it every town dentist to Provincetown. And at the end of the day, I certainly don't expect, my draft here to be sort of the final outcome. That would be confusing.
But you got a lot of good ideas here. You got a lot of good ideas, especially in the cleaning area. That was very good.
Yeah, so hopefully it gets the conversation started, makes somebody's job a lot easier. And, I'm sort of socializing it with the boards of health and the selectmen regionally, because we are all, various numbers of us are asked for input from Barnstable County, for instance, or from our local legislation, or from DPH, and so if people feel equipped, then this might be a good resource for them.
All right.
Thank you.
Very good. Thank you, Luke. This is John Beckley. Are there any other questions or comments board members want to make or ask regarding this item number 2 on the agenda? Okay, hearing none. Let's move on to. Thank you, Luke.
Bye.
Hearing none, let's move on to item 3 on the agenda, which is a discussion of face mask policy, because there was a lot going on in nearby towns in the last couple of weeks regarding local towns drafting policy statements, et cetera. And then, of course, Dr. Duncanson referred to the new order or the new regulation from the state of Massachusetts that actually goes into effect Wednesday of this week. Judy, you want to introduce any comments on this issue?
Yeah, well, so we all know that the governor's order went into effect or goes into effect Wednesday. And basically his order states, as Bob said, that any indoor or outdoor, any person over the age of 2 who is in a place open to the public in the Commonwealth, whether indoor or outdoor, and is unable or does not maintain a distance of 6 feet from every other person shall cover their mouth and nose with a mask. And then it also goes on to say anybody entering any grocery stores, pharmacies, or other retails should wear a mask. It does say that the establishments can deny people coming in without masks, and there's also a way to police it. We can issue $300 tickets, either the public health agent, myself, or my assistant, or the police. So it's quite a good jumping off point, I believe. I think, there may be some tweaks we can add to it, but I think it's very good in the way we might have liked to have gone anyways. I also had provided you with a chart kind of showing what other towns had done before this order, and most of them had done similar things, although some had just said that the people working in the establishments had to wear masks and not necessarily the people entering. So I think the governor's order is a little bit more thorough. The other thing that we might suggest would be posting, requiring all establishments to post on their doors that anybody entering must wear a mask, and that's not in the order. So those are my thoughts.
Judy, this is Noble. The $300 fine that the governor's order mentioned. How does that happen? If say a shopkeeper, someone comes in, they refuse to put on a mask, and then what happens?
It's well, I mean, obviously you'd have to kind of catch someone. It's a criminal disposition, so it's like writing a ticket, like writing a parking ticket.
But they call the police?
Yeah.
I guess they could call the police, and someone who could show up
Shopkeeper.
there, or we could, you know, occasionally go in places just to see if people are complying.
Yeah.
But yeah, I mean, it's not going to be an easy thing to enforce, and I'm hopeful that people will take this to heart, seeing a sign posted and hearing what the governor has said, that everybody needs to wear one. So, you know, and I would hate to have to, you know, it says anybody 2 and over, but it's pretty hard to keep a 3-year-old mask on. So I think we need to use some discretion in how we enforce it. But yeah, that's the gist of it.
Well, I read that, Ron Broman, I read that letter that someone sent to you about going into one of the stores here in Chatham. And I've been into the stores and seen the same thing. You know, they just walk in, you know, no gloves, no mask, nothing. And, you know, every time I go out, I have a mask on now and gloves, depending on where I'm going. So, you know, I think it's everybody's responsibility to do it. And it's just because there's a few that don't want it, but it only takes one person to infect several people. So, as we know, so I think it's very important we do something.
Yeah, this is John. I agree with what I've just heard spoken, and I think it's important to understand that the state regulation is a requirement. It says all persons are required to wear masks or cloth face coverings at all times when inside a grocery store, pharmacies, and here's a big thing, and other retail stores. So as merchants open, they all will be bound by this. And I think it's critically important that every store in Chatham have pasted to the front door a poster of some type that's brightly colored and clearly written that basically says all patrons are required, underlined. You know, do not enter the store unless you have a mask or some other face covering. I think we should require that however we can, and then the question becomes, you know, who's going to make the signs? Can the town of Chatham prepare a sign? How would we you know, is there a template already in existence? Who'd pay for them? How do we get the signs distributed? Maybe through the chamber. But my vision would be that we don't have any stores in town open that don't have a recognizable posting at the entrance.
Yeah, we could there are some templates out there, and we could definitely email them to at least all the restaurants and get them to the Chamber of Commerce for distribution. People could print them themselves.
Okay.
That's easy enough to do. I don't know if you wanted me to read. I did have an email that we received that's requested that we read it into the minutes.
I think we should do that. And now is a good time too.
Okay.
Hey, Jim. How's it going?
So, is that you, Craig?
Sorry, Judy, that was my fault.
Okay. So, this is from.
Judy, you think you should keep her name out of that?
Well, she asked that it be read into the part of the minutes. It's from a resident. I guess it doesn't matter. I can leave it out. Dear Judy Giorgio.
Hey, Judy, it's Bob.
Yeah.
It is part of the public record, so you will need to read the person's name
Okay,
Okay.
for identifying, because, yeah, it was submitted. She asked it be read at the meeting, so, yeah.
okay, so it's from
Okay.
Ann Timpson, and it was sent to Jill Goldsmith and the Board of Selectmen members, and then forwarded to the Board of Health and myself and Bob. Please read this email before the Board of Health meets. Please include it in the minutes. Chatham has been very fortunate compared to so many other coastal towns. The COVID-19 virus spread has just begun, and there is still time to put a plan in place to protect residents and visitors in the coming tourist season. However, the spread will amplify, and the town administrators must act now to prevent a full-blown surge at a time when the businesses are trying to regain financial stability and serve the public. So many establishments are entirely dependent on a busy and successful summer economy. So many employees are dependent on getting back to work and bringing in a salary once again. Governor Baker has paved the way. Please mandate the wearing of masks by all that can medically adjust to such protection in all public buildings immediately. Please mandate all to carry masks with them when leaving their homes or rentals or motels and hotel rooms. People will adjust. It will become as natural as carrying a water container. This protective gear is essential. Using the excuse that the town cannot enforce the mask mandate is unrealistic. Wearing a mask is simply being respectful to those around you. If town officials and employees are seen in mask attire, this will also set an example. Chatham at present has 11 coronavirus positive tested residents. At least one patient resides at Liberty Commons. The possibility of COVID-19 spread within this community is inevitable. We are running out of time. That is why contact tracing is the only means of controlling an epidemic. We have to assume that there are many asymptomatic residents that are contagious and people that have come in contact with the 11 affected patients. We also have to assume that when more summer residents, tourists, day trippers, and bikers arrive in Chatham in the next few months, they will bring more infection. If we act now, the number is still low enough to control the spread of disease. Contact tracing is imperative in testing as well. We cannot wait until the CDC hires surveillance teams. We need to collect local volunteers and use our present town workforce who can do contact research by phone and computer from the safety of their homes. We need to contact the Scouts and AmeriCorps. There are many retired town people who are already helping in this crisis and are looking for ways to preserve Chatham and its citizens. I have personal knowledge that one Chatham resident who tested positive for COVID-19 was neither contacted nor interviewed. We cannot depend on the Visiting Nurse Association to do contact tracing. They are overextended and working overtime already. It is time to act, not just discuss these issues. Fear is reaction, courage is a decision. We must move forward while the death toll is low and the positive count controllable. Thank you for your past efforts and for addressing this crisis with a special meeting. Best regards, Ann B. Timpson, Chatham, Mass. So.
Well,
Elaine Gibbs, if I could just comment, if you don't mind. I think we all have anecdotal stories, and my concern is that with the warm weather coming, I think all the coastal states are going to see a rise in numbers because people are going to be relocating along the coast.
Who's speaking right now, please?
Oh, I'm sorry, Elaine Gibbs.
Okay, go ahead. Continue, Elaine.
I'm sorry. I've been in the supermarket where I have seen people come in without masks, and they're within 3 feet of the people at the cash register, and it is so unfair to them. If they have to put up with that every day, the odds of them getting sick are far, far greater because the person has touched all the food and they've used the keypad for, charging things, and it's just wrong. One incident yesterday, I think, sort of summarized it. It was a car from out of state. They were down at the fish pier. I was there and in my car, and there were 5 or 6 people who had their masks on waiting for food. And this couple got out and they had no masks on, and they kept wandering around into the space of the other people who had to keep moving to keep social distancing. And then when they placed their order, they leaned on the counter and leaned into the window and placed their order. and then remained. And when they got the order, apparently it was wrong. After they went through it, they handed it back to the people inside the restaurant. Now, the only thing that guy's going to understand is a fine. And the only leverage businesses have is to post, right outside that window, we will not serve you if you don't have a mask. And it is a $300 fine. Whether or not we end up giving them out, I think that's the only thing some people understand. And I would hope that that's what we do. I think we have to set an example. We can't be afraid of offending tourists. We won't have any tourism if we can't flatten this curve and start opening up businesses. And the only way to open up businesses is to make sure everybody's safe so that we can go inside. So I'm very pleased with the conversation. I think the only question is the fine, and I think we need one. Thank you.
Yeah, the fine is part of the governor's order, so we don't need to enact that. That's already part of it. And can I ask whoever is not speaking to please mute your phone, because we're getting some feedback.
Judy, could you comment on the issue that was raised in the letter about contact tracing?
Yes, so the state has hired over 2,000, probably closer to 3,000 people at this point, through a Partners in Health organization, and they are training them to do contact tracing. And towns can choose to do their own contact tracing, or they can opt into the state's program. But what's happening now, and the VNA has been part of the contact tracing with the state right from the start. What's going to start happening in a few days, they're trying to roll out a program so that if a case is not, so they say, grabbed from the pool by the local person who does the follow-up, like the VNA or some Barnstable has their own nurses. If it's not pulled locally, then it will automatically go to the state and will be followed up from the state. Or the town can choose right from the start to let the case go to the state. So that's something that we are a part of and will continue to be a part of. And I was reassured by our people at the VNA that they are using them. The VNA has also hired many nurses to do follow-up. They're doing, I think, the best job they can right now, and they don't seem to be overwhelmed as far as what they're telling us. So I'm pretty confident in where we are with contact tracing. I do understand that early on there were some issues where someone may not have been called, but people do need to understand that the contact tracing is only as good as the information that the nurses get from the patient to begin with. So if they don't tell you enough information on who to call, then you can't call them. So, there have been, this was new in the beginning, and I think it's getting better every day. I do sit in on conference calls with the Maven tracing program twice a week, and they're just constantly evolving the program to make it better. And I think that right now the state's program is probably one of the best in the country. So I'm confident that it's going to work. It's definitely going to get more interesting as we move forward and people start leaving their homes, because there will be more contacts to trace. Right now, we don't have as many contacts because people are really staying home. So it will be important to stay up on it.
But this is John Beckley, Judy. Your sense is that we're in good shape in regard to this.
I think so for now. I mean, as I said, the state has really ramped this up. They've been working on it for a month, and the VNA has also ramped up their own pool of nurses. They've hired people. Everybody's working closely with Cape Cod Healthcare as well. And all the towns talk to each other. If a case comes through and it should be to another town, it can be transferred. Or if we have a case that we think should be with us that may be at another town, we can reach out and follow up on it. But again, it's only as good as the information we get originally from the patient. So, but I feel confident, yes.
Understood. Thank you, Judy. Any more
Yeah,
questions?
John, it's Bob. I just wanted to weigh in. Judy and I talk about this almost daily. We also talk about it regularly with the VNA folks. And the other thing I think we need to understand, or the public needs to understand as well, there are cases out there that don't necessarily ever get into the system because they're diagnosed by their physician. The physician tells them to stay home for 2 weeks. He doesn't order a test necessarily because he makes the determination based on the symptomology that's presented. So there are people out there, and we've heard some anecdotal stories. You know, there's people out there that based on their physician, they've been identified as having COVID-19. They self-quarantine right off the bat. So they never get into the system. So we don't know about them necessarily. VNA doesn't know about them. Even if the state contact tracers wouldn't necessarily know about them. So I just wanted to put that out there because I think there's a misconception on the part of the public that we in the public health sector know about every case that's out there. And that isn't 100% true.
That's a good point.
Bob, this is Noble. Does that include cases tested positive that you might not know about?
I think if they have a test done, those we would know about. You know, most of the, I shouldn't say most, as far as I'm aware, all the commercial laboratories, the hospital labs, and all the locations that are doing testing are now inputting that system into the database. So those we would get flags on.
Right.
That's why I say it's really just the people that are being, you know, my doctor says I have COVID-19 because all my symptomology is X.
A clinical
So I'm going
diagnosis.
to stay home for 2 weeks, you know, and they never get a test. And there are
Yeah.
people that, you know, are doing that and aren't tested. Those we would not necessarily know about.
Yeah, this is Noble. Let me just ask Judy, I guess, what would you say to this letter writer who says they have personal knowledge of a resident who tested positive and was not contacted? She says this in her letter.
Well, I'm not sure which case she's talking about. There was one case early on where there was some confusion that whether the person had been identified as a contact, and so it could have been that person. And then they finally came in as a contact because the person themselves told us that they were, and then they weren't followed up by the state. When they came down with it, the VNA kind of dropped the ball for a few days and did not contact her directly, even though we had already were aware of her. And so that was one case where I think there was some confusion. But that's the only case I can think of. I mean, everybody else of the 11 on our rules right now have all been talked to by either myself and the VNA or just the VNA. So.
Yeah, this is Lynn Gibbs. I do happen to know a couple of the people who got it early on. And I think one of the problems is maybe the VNA's gotten better at it, but in terms of how they question patients and making sure they get all the details. And you have to remember that when they've contacted these people are sick. And so the VNA has to be patient with them and say, maybe you want to get out a calendar. I mean, if I were really ill and they said, who did you contact in the last 2 weeks? I probably would say, I don't remember. Can you give me some time so I can get out my calendar and figure it out? Because that is critical data. And hopefully they've improved on that kind of questioning and making sure they have gotten those contacts, because that is going to be the basis down the road for making sure, you know, we notify people who have come in contact.
I just want to clarify right from the beginning what the definition of a contact was. In the early days of this, 6 weeks ago, a contact was anybody who you had contact with from the time you were symptomatic moving forward. So it does nothing to do with the people you had contact with 2 weeks before. Now they've changed the contact to anybody you had contact with 48 hours before you were symptomatic. So you really only have to remember who you talked to in the past or were with in the last 2 days. And the definition of a contact is someone who you were within 6 feet of for 15 minutes or more. So it really needs to be, or a family member, someone you live with. It really needs to be someone who you've had close contact with. That was where some of the confusion was in the beginning, I believe.
I'm sorry, Judy, I disagree with that. That people are asymptomatic and they are giving it to other people. And it was definitely, who have you seen within the last 2 weeks when you were asymptomatic, before you came down with the symptoms? And we all know that now. That's why, you know, they're saying you have to.
The state says that you're only contagious 48 hours prior to becoming symptomatic.
I have never heard that.
Then that's the guideline that has come down from the CDC and the DPH for following up on contacts.
You can be asymptomatic and give it to other people. To say you're only contagious two days prior to symptoms, some people never have any symptoms and yet they're contagious. So I think that's totally misleading to even suggest that. If somebody has it, you need to go back and find out who they were with. One of the people has actually been at a special town meeting with 600 people in the room 2 weeks prior to getting sick. So,
yeah, well, the guideline again is what I said. It's 48 hours prior to symptoms. If you're asymptomatic, you don't necessarily even know you have it. So, you know, you can't contact people because you're not sick. So you haven't been proven that you had it.
I'm saying once you get it, if you were asymptomatic and suddenly you find out you have it, then you have to go back 2 weeks to see who, because you could have been contagious for 2 weeks and contacted people. There are people getting sick.
And they're not saying 2 weeks, they say 48 hours. That's the DPH and the CDC guideline.
Okay.
John, we have a question from someone on the line. Is Kimberly Robbins out there? Kimberly, if you're out there, you need to unmute your phone.
Ms. Robbins?
Okay, I don't hear her, so we can check back again.
The other issue I think I should at least mention that was contained as a recommendation from Ms. Timpson was the idea of mandating that everybody carry masks with them. I don't know how practical that would be, but her view is that people should not leave their homes without a mask.
You know, it's important though that we, Ron Brumman, it's important that we say what type of mask. I mean, you see some people that just wear a turtleneck and pull it up over their face. Other people have those really, probably very expensive ones that got the resuscitator right inside of them. I mean, I've got ones that my doctor gave me quite a few months ago before we went to Florida. And they're the ones now that they're saying we shouldn't be using because they need them in hospitals. So I don't know. What is a good mask? Can my wife make them out of some material and then be as effective as that?
Yeah, it's Bob.
Yeah.
The guidance out of CDC, World Health, the state, and everybody else is right now, you know, and you'll see this in some of the press releases and some of the guidance. They're not even specifically saying you need a mask. What they're saying is you need a face covering. Now, obviously, most people are using masks, but, you know, the idea of strictly putting a bandana or, you know, on the CDC website, they have directions how to make a mask out of a T-shirt. Anything that would block the droplets is what's being recommended.
Okay.
Everybody is recommending you don't need the level of like an N95 mask or something like that. They are still in short supply. Those are being saved for the first responders and the folks in the healthcare field that really need those. For the average person on the street, and you got to remember, this goes back to what Judy was alluding to. You know, what is a close contact? I mean, I get this question all the time. If I pass somebody on the street and we're just walking in opposite directions and, you know, we pass somebody for 2 seconds, is that a problem? The answer, quite honestly, right now is more than likely it is not a problem. you really need to be near somebody who is symptomatic or within that 48-hour window before they experience symptoms. And you need to be there for a prolonged period of time. The guidance is at least 15 minutes or so. So, if you're just walking into a store or walking up and down Main Street or walking on the beach and you're going by people, in all likelihood, those are not the kind of things we're seeing problems arise from. So, yeah, a cloth mask, either, made at home. As I said, there's CDC has guidance. There's Facebook guidance. There's YouTube videos out there on how to make them. There's some people on the Cape that are now supplying them. We have some information up on the website where you can buy them. And I know national organizations are now selling them. In terms of giving them out to everybody, that more than likely is not going to happen at the municipal level. We can't afford to. We are procuring disposable masks that, once we reopen town buildings and the public can get access again if they need it, we'll probably be asking the public to take one of our masks and wear it while they're in conducting whatever business they have to conduct, at the same time practicing social distancing and everything else. We have also talked potentially about, giving out masks through the COA to the elderly population that may not be able to get them from any other source. But as everybody's aware, masks are still in short supply and they're difficult to come by. We're trying to get them from different locations so that, once we do decide to reopen the town facilities and whatnot, we have a supply. It won't be enough for the entire community. But for the people that still need to come in and interact, with town staff in close quarters, we're trying to set that up as best we can.
And also, Bob, it does say in the regulation that all persons are strongly discouraged from using medical grade masks to meet the requirements of this order, as medical grade masks should be reserved for healthcare workers and first responders. So he's definitely, as Bob said, alluding to face coverings, cloth, homemade, bandanas, those types of things.
Good. Okay.
This is Noble. I wanted to just bring it back to John's point about wearing masks outside, because wearing them inside now is pretty much covered by what the governor has just said on Friday. Wearing them outside, I believe what he says is, if you think you may not be able to social distance, be 6 feet from someone, then you need to have a mask. So it's discretionary. The problem is you never really know for sure when that's going to happen. And the other problem is, and I think this is going to be more of a problem when we get to Memorial Day weekend or into the summer, if you're walking downtown in the village on the sidewalk, which is two ways with people, it's going to be impossible to walk there and not be going against a 6-foot social distancing recommendation. I mean, to me. So I know what Provincetown did where they said you had to wear a mask between certain streets is sort of beyond what most towns have done, but not unreasonable for their situation. And I would just say for Chatham that we at least need to keep our eye on what's happening downtown, because we may have to consider something like that. I know it's hard to enforce, but just to follow up on John's point.
Yeah, Noble, this is John. I agree with you 100%. I was just sitting here saying there's no way to walk up and down the sidewalk of Chatham with two-way traffic. What are you going to do? You're going to move from the left to the right? You're going to continually dodge people? You can't. So I think the expectation should be that if people are walking in downtown Chatham, in that zone, they should be having a face covering, period.
Yeah,
Does that mean have one around their neck available, or does that mean actually be wearing one? Two different things. I think as more shops open, retail places open downtown at some point, and hopefully it won't be that far away, people will need to have a mask if they're going to be ready to go inside or do anything. So it's not that onerous to get into that kind of a requirement.
It's a new normal, Noble. I just think people who go downtown Chatham should wear a mask. And they can go wherever they want to go. They can
Yeah,
walk the
John, it's Bob.
sidewalk.
Because you never know if someone's going to let a sneeze go standing right next to you. You never know that. You know, if you're walking downtown, someone could just sneeze and then it's in the air and you're walking right by them. So, you know, some type of mask or something should be around their face.
What were you
Yeah,
gonna
John,
say, Bob?
Yeah, I was just going to say, I mean, these are all questions that are being discussed or issues that are being discussed right now with the town, with the Chamber of Commerce, and frankly, with other towns on the Cape as how to deal with these kind of things. You know, some of the ideas that have been bandied about is make sidewalks one way, prohibit parking in the downtown areas so that you can walk in the street and people can spread out more. So I think over the next couple of weeks, you're going to see some ideas coming out. The town is having a forum on May 11th from 6 to 8. Or actually, I see now it's 6 to 9, looking for input and suggestions from the community on how to deal with some of these things, you know, as we get towards the busier summer season. And I'm sure we're going to get more ideas coming out of that. Some will be not realistic. You know, others, you know, banning parking on Main Street for a couple of blocks in the summer, you know, while we have our satellite parking lots and all, that may have some merit so that people can spread out so you're not all, you know, crammed in that 4 or 5 foot wide sidewalk. But those are all things that I'm sure the community is going to be discussing over the next couple of weeks.
Okay, that's a very good point.
Yeah.
Okay. Well, yeah, this is Noble. Yeah, so that's good news. Memorial Day weekend is less than 3 weeks away, so that'll be interesting.
Elaine
Judy,
Gibbs, one more time. I would hope that I would like to see us come down firmly on that now. We can always loosen it up, but we are going to start seeing a ton of people coming in here. If we want to get back to business and get people working again, we cannot allow this curve to continue to surge. It has to flatten out and it has to slow down. And with 1,000 new cases yesterday in Massachusetts, I see that number going up, not down, unless we do our part and everybody wears masks. I agree with Noble. I think that we might as well just do it. Everybody will get used to it. It's not forever, but we're going to have to do it now so that we're not trying to train people on July 4th weekend when it will be too late and people will start getting sick and the numbers are going to go up. So I hope that we don't worry about tourism. The whole world knows this is going on. This is not a surprise. Everybody's got the memo. And if you want to come to Chatham, you got to have something around your neck so that in the event you bump into somebody, you can protect yourself and show respect for them as well. We got a lot of old people here, and I see them struggling to go into CVS and to the market to get food and their prescriptions. And I'm really offended when I see people walking in without masks. It is really disrespectful and lazy. And so I hope that the Board of Health, you're the only people who can do it. I hope you set an example for the rest of the Cape. And everybody will follow suit and everybody will do it. And then we'll get back to business and we can take our masks off. Thank you.
This is Noble. Yeah, I'd ask Bob. I mean, are you meaning to say that you think we're ahead of the curve if we began to think about what Provincetown has done?
I think that's definitely a topic for discussion. Obviously, you know, the business community may have a totally different take on suggestions like that. And that's why, you know, the Board of Selectmen, one of the reasons why they set up this community forum was to get input and hear from all the different people involved. But I think, you know, I think it's definitely worth considering. You know, if you're going to be in this particular zone, you need to wear a mask. You know, under the governor's, you know, order, if you're going into a retail business, you're going to have to wear a mask. You know, he specifically called out grocery stores and pharmacies, but he included other retail establishments, you know, giving us an indication that even once the essential business order is lifted, and regular retail establishments are able to open, to go into any one of those, you're going to have that mask on. So obviously that's going to dictate, people wanting to come to Chatham. If they just want to stroll Main Street, that's one thing. But if they have any intention of going into a store or what, they're going to have a mask. So there's going to be a lot of discussion about this over the next, week or so, to figure out what will work, what's feasible, what will people accept, what will the business community accept, and whatnot, and ultimately we'll come out with something, that works. One of the things that Judy and I have talked about is, spot checks. We know that there's certain places like CVS and Chatham Village Market and Cumbies and all where we've gotten calls about compliance. We can do spot checks on those facilities, now and as the future unfolds with the governor's order taking effect on Wednesday, and say, look, you need to be doing these things. You need to have all your people in the stores doing it. And stores have the right under the governor's order, not to let somebody in if they're not complying with it. As a business owner, will they do it? I don't know. But they have the ability to do that under the order. Can we enhance that by requiring signage? Absolutely. And that's a relatively easy thing for the businesses to comply with.
Right. Bob,
this is Noble. Joe, just one quick thing. Noble, I don't think it's particularly burdensome at this point to ask someone to have a mask, personally. The other thing I might suggest, because I think this is something that the situation is ongoing, and we'll have to talk about it again, and it combines with another thought I have, and that is that maybe we should think about it and let things develop. But I think we maybe should have a meeting, next Monday, and not go so long between meetings, because things are happening so fast, and this is an open issue, and put this thing on the agenda for next Monday to bring up and hash over again. That'd be kind of a compromise.
The only thing about, this is Judy, the only thing about next Monday, it's when the forum is that Bob's been referring to.
Oh, yeah.
So, we might want to wait until after the forum to get a little bit more of a feel for what the townsfolk are thinking. I would think that it would be a good idea, if you thought so, to move forward with requiring the signage that we've
This
just.
is for going in the store.
The signage, right, on outside the door, saying all patrons
Absolutely
must, under Chatham Board of Health order, whereas Chatham Board of Health and the, governor's order, wear a mask. I think that would be a good way to at least strengthen what we have in place by the governor now. And then as we move forward, we can talk further about the idea of requiring masks on Main Street in the summer.
This is Noble again. Yeah, I would say I've been asking people and friends talking to me. I mean, I've actually gone and asked people, what do you think about if it was required that you have a mask, on the Main Street in downtown Chatham? Everybody that I talk to says, good, great idea, do it. They are looking for us to be more proactive. That's all the feedback that I get, basically. Just personally.
Noble,
I think it's important that we do the signage right away, Ron Broman. I think we should do that and take a vote and get the signage up. At least we're starting to do something if we do that, and that's doable right now.
All right.
Agree?
Let's
I'd like to make that a motion.
I agree with that. This is John Beckley. I agree with that. And maybe we take this moment right now as the board to poll the board members on whether you would support Judy working up a Board of Health. I don't know what we would call it, Judy, an advisory, or would it be a regulation? How would we frame it? But is there support on the board for moving ahead forthwith and asking Judy to formalize the Board of Health action in regard to requiring the posting, conspicuous posting, at the entrance of every retail outlet in public building and private retail outlet, the signage regarding the requirement for face coverage.
Yes.
Hey, John?
I'd like to make a motion. I'd like to make a motion of that, Ron Broman.
Okay, Ron, we have a motion from Ron. Do we have a second from anyone?
Second, Alan.
Alan is a second. Okay. Is there any further discussion, or are we ready to vote on as the board on this? Okay, I'll call the vote. All in
John?
favor?
John,
John, you need to do a roll call.
I know. I'm
yeah,
about to
and
do
John,
that.
this is Judy.
Oh,
Can
that's
I
right.
just say that you might want to add to that, any common areas of any multi-unit family, residences, those types of areas?
I think we
So-
should leave it up to Judy if she comes across another area that, we didn't talk about or mention, that she would give
So
her the
public buildings,
discretion to put it up.
public and private buildings and any residential multifamily units with common areas like laundry rooms and, front
Ron?
foyer.
Ron, will you accept that amendment?
Yes, definitely. Leave it, if Judy comes across them, we'll certainly leave it up to her discretion.
All right,
Okay.
let me do a roll call and see whether board members are comfortable with going this way. Dr. Hanson,
Yes.
Dr. Ward,
Yes.
Ed Sheehan,
Yes.
Ron Broman,
Yes.
and I'm a yes as well. So that's a unanimous approval. Judy, how would we frame this in terms of the wording of it?
I
The
could do,
legality of it?
I would do it as an emergency order of the Board of Health, I guess. And I could put that together pretty quickly and get it out to you all to look at. And, Bob, do you think we need to vote on this again, or can we do it as what they said and with me moving forward with it?
Yeah, I think it's fine. I think you as the agent have been given the authority by the Board of Health to go ahead and promulgate an emergency order.
Okay,
Well, I'm very happy about that, and I think the other board members should be as well. And then what I was writing down, I'm warming up to the idea that we require the wearing of masks in our downtown retail area, and just call it have an identified downtown retail zone, and just mandate. But I defer to doing that until after the May 11th town meeting, and I would urge that board members participate in that meeting, and we make sure to get some suggestions in this regard offered, and see how what the response is or what the reaction might be.
Maybe Judy and Bob could write something up about the mask. I mean, some type of order that we want to have go out. I think they would be able to much easier write it up than we would be able to, doing it over the phone like this.
A proposal, you mean a tentative proposal?
Yes, yeah.
Yeah, we could produce a draft for you guys to review it at the next meeting, and after we hear, what comes out of the community forum next week.
Yeah.
This is John.
Noble. Yeah, I agree with what John just said about the timing. The forum next Monday, and then the following Monday, our meeting, and we'd have a proposal, and we kind of go from there.
Yeah. Now, is it possible for us to have a meeting? Because we certainly could space ourselves out far enough in that meeting place, and just limit it to a certain number of people that first come, first serve, and keep them spaced out.
Right now, we're not, Ron, right now, the policy of the town is we're not doing any face-to-face meetings.
Okay.
Just because we have the ability to do it remotely like this. So for the time being, at least, we're keeping that process.
Nope, that's fine, Bob, if that's the rule.
This is John. I would point out that if we wait until the Monday after the May 11th date, that is May 18th, which is a big date for the state of Massachusetts in terms of announcing their reopening policies and everything. But we could still do it on May 18th if that's the board's wishes.
Yeah, and
I
keep
wouldn't
in
do it.
mind,
I wouldn't postpone it any.
Yeah, you guys can have a meeting anytime you want. We just need 48 hours notice.
Right.
So we don't have to wait for a full week. You know, if you want to have a meeting, you know, on the 12th or the 13th or something, I mean, we could certainly set that up. We could always call a meeting for then tentatively and then cancel it if for whatever reason it's not needed.
I see. Okay. Well, I guess the question is, do we as a board, are we comfortable enough right now moving ahead with a policy direction through which we would be requiring all members of the public to wear face coverings when in the downtown retail zone? Or do we simply want to have that floated as a possibility at the May 11th public meeting and then wait for feedback or reaction to it and then consider it thereafter? Because those are two different paths of action.
Yeah. And I
What
also
board
think
members
instead of saying the public area or any public facility, because some of them might be outside of the thing. Like I think that CVS might be outside of the public area, you know, downtown area. The CV
Yeah,
and the
that's
corner
right.
market there. Yeah, and the corner
That's
market.
right.
Yeah, but keep in mind that places like CVS and Chatham Village Market, they're covered under the governor's order. They are specifically called out as places where masks are required.
Okay, that's a good point.
And, you know, even the governor's order goes on to talk about retail establishments. So to go into any of the stores on Main Street, you'd need to have the mask. So I think what you guys are talking about is along the lines of what Provincetown did, which was if you're between point A and point B and you're on the street, you need to wear a mask.
Exactly.
And, you know, I would suggest that maybe, you know, my suggestion would be to wait until we hear the community forum because, you know, there may be reasons, and I can't think of what they would be at this point,
Okay.
you know, where that's potentially problematic. Or, you know, if they go the route of closing the road off to parking and people can walk in the street and all that kind of stuff, you know, it may somewhat mitigate the need. But
Okay.
that would be my recommendation at this point.
John, this is Noble. I think waiting until after the forum, that's Monday the 11th, but maybe moving the meeting up because these are easy to do by phone, you know, to the 12th or the 13th would be a way. We'd only be delaying a week, which is, you know, not bad at all.
Well, we
Yeah,
could go
that's
a
a
little
good
bit later in the week too.
Sure.
So that we could do it like Thursday, you know, 12, 13, Tuesday, Wednesday, Thursday, 11, 12, 20. We could do it the 14th, for instance.
Yeah.
Week for-
Now, does that date have to be decided now, or is that something that you and Judy can sort of decide on?
Well, we would let Judy know if we wanted her to plan a meeting on the 14th.
Yeah, I need 48 hours. We do have a meeting on the 18th scheduled, and we have a hearing for I think it's a septic issue scheduled for that day. So we may have to have two meetings, or else I could see if they would want to join us on an earlier meeting, if that would be possible. But well, you can let me know, or John and I can talk and decide if we want to meet on the 14th. We could do that. That would be fine.
Can I ask another question? Who's going to present to this forum that's coming up? Judy, will you tell what the Board of Health is looking at and looking to do? Or will Bob
Really
do
for
it?
the public. It's for the public.
Yeah, there isn't going to be any presentation per se. It's really a listening session by the Board of Selectmen and administration and the rest of the community. It'll be a phone thing like this, and people will just have 3 minutes to talk about what their topic is and their concern. And you know, I hope that some members of the Board of Health will be on the call as well, and you guys can hear that. And then, you know, from that, you may take whatever action you think is appropriate. And the same thing with the Board of Selectmen and the administration, you know, in terms of things like July 4th parade and fireworks and, you know, Memorial Day celebrations and some of those other big events that, you know, are coming up here relatively quickly. So, yeah, it's not going to be a presentation type thing. It's really just an opportunity for the public to weigh in with their idea.
Okay.
Bob, this is John. Do you think the concept of two-directional sidewalk use and or closing of public roads to create more, do you think those types of suggestions would be raised?
I wouldn't be at all surprised because I've heard that already from people.
Okay.
You know, and I've seen that raised in other towns, both, you know, in this region as well as other locations around the country as ways to, you know, do the same kinds of
Okay.
things you're talking about.
Okay. Do Board of Health members want to say anything about their preference for meeting next on May 14th or May 18th?
No, anything that works for everybody. I'm, you know, I think we're all open.
I could go either way on this. I don't.
Yeah. No, I'm open to
All right.
anything. Yeah.
Okay, I'll talk to Judy then after the meeting today. All right. Well, we've covered a lot of ground today. Are there any further comments or discussion about the face mask policy anybody would like to raise?
No.
Okay, why don't we do some other business we have got to attend to?
John, can I just pick up one other point on a different topic, just real quick?
Absolutely.
And this is probably for Dr. Bob. You know, I'm on the parade committee also. We can't meet because it's an advisory committee, so we're kind of in limbo. And we're getting to a point where almost everybody thinks we're not going to be able to have the 4th of July parade, but it's the process. Who is going to actually make this decision to not have the parade or have it? Because things, I mean, the committee is ongoing with things. They're committing to things. They're getting entrants. They're buying things. So that's basically my question.
I don't have a specific answer for you, but I think if it was a recommendation, say the Board of Health and the Board of Selectmen and others to not have the parade, that's where the decision was made. I mean, I know in other towns, boards of selectmen have made those kinds of high-level policy decisions for the municipality. So I suspect that that's where it would come from.
Is this something
but,
that would
you know,
have to be put on the agenda of the Board of Selectmen to generate a discussion?
I think that's what's going to happen. I think that's probably what's going to come out of this forum on the 11th is, you know, something
Okay.
probably on their agenda the next week about, all right, what are we going to do with some of these high profile events? What are we going to, you know, what are we going to do about town beaches? What are we going to do about this? What are we going to do about that for the
Okay.
summer? You know?
Okay, so after the forum, then, okay.
I think the Board of Health should certainly have an input into some of that, you know. I mean, I know when, Bob, you'll remember when we closed the Lighthouse Beach, you know, and what went on with that. It was quite a episode. But I do think, you know, there's a lot of things in there that are health related too. So I think, you know.
Absolutely.
Yeah.
And I think you only need to see what's happened in some of the other towns on the Cape where, you know, I hate to say it, but there was a little bit of a Donnybrook between boards of health and boards of selectmen. So I think the better communication we have with them and you guys, we can avoid those things. And I think if there's, you know, I mean, this is a public health emergency, so I think that has to really carry the most weight. But, you know, let's face it, the economic impact on the Cape has been substantial as well. So, you know, hopefully it's a joint meeting or a joint consensus or however it's arrived at, but there definitely needs to be discussion from both sides.
Yes, yeah.
Well,
Yeah,
maybe
Mr. Noble, I agree with that.
maybe the Board of Selectmen should request an opinion from the Board of Health.
Yeah, well, Bob, you probably can do it in a diplomatic way because you talk to a lot of them a lot. You know, we don't talk to them. I only know a couple of the selectmen to talk to. But no, that, you know, we would support them and hope they would support us on any of these big issues because, you know, it's important. Because you know, you remember about the Lighthouse Beach, what that became.
Yep.
Yeah, and you know, and it was that letter that we had that just said like one common thing, and we closed it down and we straightened it out, and that's, you know, what I think is important the Board of Health does.
Yep.
This is John speaking. Anecdotally, if you look back in history and you look to the 2018 pandemic, they had a classic comparison with two cities at the time, one that chose to have their parades on the 4th of July and the other one that banned them. And it couldn't be clearer when you looked at the case counts, the difference that made in terms of amount of disease. And so, I mean, right there you have a classic case not to be ignored. Now
they're not going to be able to be standing so far apart on a day of parade.
It's not going to work. It's not going to work.
Absolutely not. You got people without masks on. It's a nightmare. Yeah. I think we personally, if we're going to
This is Judy. If you would like, we could put this on for discussion at one of our upcoming meetings and maybe drive the discussion a little bit and then make a recommendation to the selectmen.
Yeah. I don't want it to become an adversarial thing. You know, they want one thing, we say one thing. You know, I want it to be.
This is Noble. Would we want to solicit some input from them before we made a decision? So it was kind of a joint thing. Corey Metters is the liaison on the parade committee.
Mm-hmm.
So Corey Metters is the liaison on the parade committee.
We could make a Board of Health recommendation based upon public health concerns.
Sure, we can. But I mean, Dr. Bob said it's nice to not blindside the Board of Selectmen and make sure that they're in the loop when we're doing it.
I agree.
May I jump in, Elaine Gibbs?
Sure.
I'm surprised with this conversation when we're dealing with a pandemic. It seems to me, and what I would like as a private citizen, is to know that the Board of Health has the final decision. I would rather have you go and ask the Board of Selectmen what are their concerns, but ultimately it should be their call. It should be your call, because they will be thinking about other things, budget, tourism and stuff. All you should be worried about is the health and the transmission of disease and making sure that the people are safe. So I would like to know that the Board of Health is the one calling the final shots. And not the
we can call a shot, but it's nice to have the selectmen on board with it. And probably they feel the same way. They'd like to have the Board of Health on board with it if they make the decision. I think the important thing is that the decision gets made with an agreement from the Board of Health and the Board of Selectmen.
Well, I agree.
Well, hi, this is John. Why don't we go ahead, Judy, and place this as an agenda item for an upcoming meeting at the Board of Health, and just put that in there as a placeholder, and then we can discuss it in more detail at that time. But I agree with pretty much what I'm hearing.
Okay.
Okay.
Yep. That's perfect.
Okay. Before we adjourn today, we have an obligation to move forward approval of 3 meeting minutes. I've read them through. I don't see any need for edits, but I want to ask board members if they have any requested revisions. But let's take them one at a time. Let's go to the March 19th Board of Health minutes. Do we have any Board of Health member comments or questions or edits before we go for a motion to approve? Can I get a motion to approve?
So moved.
Motion to approve.
Okay,
Noble.
who did the motion
Noble.
and who seconded?
Alan?
Alan, okay. We have a motion to approve and a second. I gotta call the votes. Dr. Hanson, are you
Approve.
in favor? Approve, okay. Dr. Ward,
Approve.
Ed Sheehan,
Approve.
Ron Broman,
Abstain. I was absent.
and myself. I would vote to approve. So the minutes for March 19th are approved. Let's go to the meeting minutes for March 30th. which was our combined meeting between the Board of Health and the Board of Selectmen. Can I get a motion to approve those minutes?
So
Noble
moved,
motion.
Alan.
Second, Noble.
Alan motion, Noble second. Any questions or comments, edits? Hearing none, I'll call the question. I can't do it that way. Dr. Hanson, are you in
Approved.
favor of approving the minutes? Approved. Dr. Ward?
Yes.
Ed Sheehan?
Approved.
Ron Broman?
Approve.
And myself, John Beckley, I approve. Okay, those minutes have been approved. Finally, we have the minutes of April 13th to consider. Can I get a motion to approve those minutes?
So move, Alan.
Good. Can I get a second?
Second, Noble.
Second, Noble. Okay, any further questions or comments or edits on those? Hearing none. Dr. Hanson, are you in favor of approving the minutes?
Yes.
Dr. Ward?
Yes.
Ed Sheehan?
Yes.
Ron Broman?
Abstain.
And myself, John Beckley, I approve. Okay, those minutes have been approved. So we have basically covered the agenda for tonight, unless any board member wants to raise any final issue or concern. Anyone care to do that? Otherwise, I'd like to request a motion to adjourn.
Move we adjourn, Alan.
Can I get a second?
Second, Ed Sheehan.
Oh, you're doing it very well, folks, now, because you're saying who's speaking up. In any event, okay, we have a motion and a second to adjourn the meeting for tonight. Dr. Hanson, are you in favor of that?
In favor?
Dr. Ward?
Yes.
Ed Sheehan?
Approve.
Ron Broman?
Yes.
And myself. Approved. So we've approved the adjournment. The meeting's over. Thank you, everyone, for all of your participation and your interest. And see you next time.